What if I told you that your body is actually willing to physically destroy your teeth, literally grinding them down to the absolute nerves just to keep you breathing while you sleep?
I mean, it's a terrifying, but honestly, completely brilliant biological failsafe.
Yeah.
We prioritize oxygen over enamel every single time.
Every time. And it completely shatters how most of us think about dentistry, doesn't it?
Oh, absolutely.
Because usually, when you think about going to the dentist, you anticipate a mild scolding.
Right, the lecture.
Yeah. You sit in the chair, they shine that incredibly bright light right in your eyes, and you just brace yourself for the inevitable question about your flossing habits. It feels very, I don't know, routine, almost transactional.
Yeah, we tend to view the mouth as this isolated system. Like it's basically a separate zip code from the rest of our medical care,
Exactly.
which is just a massive blind spot in modern healthcare. I mean, for decades, we've treated dentistry as purely mechanical maintenance. We check for cavities, we polish the enamel, we fix a chip, and then we just send you on your way. But the reality is that the mouth is the primary gateway to the body. You simply cannot be systemically healthy if you're chronically infected at that gateway.
And that is exactly the mission of today's deep dive. We are exploring the fascinating and, frankly, highly consequential mouth-body connection. Plus, this incredible emerging field of airway health.
It's such an important topic.
It really is. And to really understand this, we are looking through the lens of a very specific philosophy of care, one pioneered by clinics like My Gentle Dentist Arana Hills, located over in Brisbane, Australia.
Their model is fantastic.
Yeah, their entire model is built on preventative, patient-centered care. They focus on modern, gentle techniques specifically to eliminate dental anxiety. Because, avoiding the dentist doesn't just mean risking a cavity anymore.
No, not at all.
It means missing out on vital, whole-body health care.
It really represents a total paradigm shift. What a modern preventative dentist is actually doing when they look inside your mouth, they're conducting a frontline screening of your immune system, your metabolic function, and even your cardiovascular risk.
So I want to unpack the biology behind this. Because it's one thing to just say, the mouth is connected to the body.
Sure.
It's another to understand exactly how that mechanism works. So let's start with the microscopic environment. In the sources, I kept picturing the human mouth as this bustling, incredibly crowded metropolis.
That's a great way to think about it.
Right. We are talking about over 700 different species of bacteria residing in there.
Yeah, it's a massive ecosystem.
And under normal conditions, they're just living their lives, doing their thing. But what happens when that balance tips? Walk me through the mechanics of how this microscopic city descends into total chaos.
Okay, so the shift you're talking about is moving from symbiosis, where everything is in perfect balance, to dysbiosis.
Dysbiosis. Okay.
Right. And it usually starts with poor oral hygiene or a diet that's just too high in fermentable carbohydrates. The bacterial load increases, specifically the anaerobic bacteria.
The ones that don't need oxygen.
Exactly. They thrive in environments without oxygen, like down in the deep pockets of your gums. So the good bacteria essentially get overrun. And this triggers an immune response. Your gums, which are designed to form this tight, fibrous, protective seal around the neck of each tooth, they become inflamed.
So the body is actively sending blood flow and immune cells to fight off the overpopulation, which is why the gums swell up and bleed when you brush.
Yes, but here's the critical structural failure. When those gums become chronically inflamed, the epithelial lining, the tissue that's directly touching the tooth, it begins to ulcerate at a microscopic level.
Oh, wow.
Yeah. The tight junctions between the cells actually break apart. You lose the physical barrier.
So the city walls are breached.
Exactly. And once that barrier is broken, harmful bacteria and their toxic byproducts can literally slip out of the mouth and directly into your systemic bloodstream.
And there is one specific bacterium that seems to be the main villain here, right?
Yes, Porphyromonas gingivalis.
Porphyromonas gingivalis.
You got it. It is a highly aggressive periodontal pathogen. But the thing is, it doesn't travel alone. When your immune system detects this breach, it releases pro-inflammatory cytokines.
Which are like chemical alarm signals.
Right. So now you have highly aggressive bacteria and a massive flood of inflammatory alarm bells just circulating through your entire vascular system.
Okay, stop right there. Because this is where I really need to understand the leak.
Sure.
It makes complete sense that my gums are inflamed if they're infected. But how does that localized infection in my jaw accelerate aging in the rest of my body?
It comes down to a concept known as inflammaging.
Inflammaging.
Yeah, inflammation and aging. Periodontal disease is not a localized temporary problem. It is an active, chronic, low-grade inflammatory infection because your immune system is constantly fighting this bacterial invasion 24 hours a day, 7 days a week. Your immune response is permanently left in the on position.
Man, it's like leaving the engine of your car redlining in the driveway all night.
That's a perfect analogy.
You're just going to burn out the engine.
Totally. This constant low-level systemic inflammation just exhausts your immune system. It damages healthy tissue collaterally, and it wears down your cellular resilience over time, which literally accelerates biological aging.
That is wild.
By resolving an oral infection, you finally shut off those alarm bells, allowing your immune system to stand down and reducing the overall inflammatory load on your entire body.
Which frames treating gum disease not as this, cosmetic fix, but as a way to literally keep your cells biologically younger.
Exactly.
But I want to push back a little on where these bacteria actually ends up. It's one thing to say they're in the bloodstream, but we are looking at research linking gum disease to memory and blood sugar.
Right.
I'm struggling to see the pathway there. How does a bleeding gum affect the heart or the brain? Walk me through that.
Okay, let's trace it, starting with the cardiovascular system. So those cytokines and bacteria, specifically P. gingivalis, they're now traveling through your blood vessels. As they circulate, they physically irritate the delicate inner lining of your arteries, called the endothelium. This irritation causes endothelial dysfunction.
So the pipes themselves get irritated.
Yes. The artery walls become inflamed, which attracts immune cells called macrophages. These cells try to clean up the inflammation, but they end up accumulating cholesterol and turning into what we call foam cells, and those get embedded in the artery wall.
So the inflammation from the mouth is actively laying down the mortar for arterial plaque.
Precisely. It accelerates atherosclerosis, the hardening and clogging of the arteries. This is exactly why chronic oral inflammation is biologically and directly linked to an elevated risk of heart attacks and strokes. You are basically constantly pumping inflammatory debris into your vascular pipes.
Okay, the cardiovascular link makes mechanical sense. But what about type 2 diabetes? Because I've always heard that if you have diabetes, you're more prone to gum disease.
Oh, right.
But the sources suggest it goes the other way around, too.
It is absolutely a two-way street. We've known for a long time that uncontrolled blood sugar makes gum disease worse because excess glucose in the saliva literally feeds the pathogenic bacteria.
Makes sense.
And poor microcirculation makes it harder for the gums to heal. But the reverse is where people get totally caught off guard. Active gum disease severely exacerbates insulin resistance.
Wait, how does a gum infection stop insulin from working?
It goes right back to those systemic inflammatory cytokines. When they flood the body, they actually interfere with the insulin receptor pathways on your cells.
Oh, wow.
Yeah. Your pancreas might be producing plenty of insulin, but the inflammation prevents your cells from hearing the signal to open up and let the glucose in.
That's crazy.
It deeply impairs glycemic control. You could be dialing in your diet perfectly, meticulously tracking your macros, but if your gums are severely inflamed, your body is biologically resisting insulin. Untreated gum disease acts as this hidden anchor holding back your metabolic health.
That is a massive insight for anyone struggling to manage their blood sugar. And then there is the brain. You mentioned the bacteria can reach the brain, but I thought we had the blood-brain barrier specifically to prevent things like mouth bacteria from getting in.
We do. But P. gingivalis has evolved a very sophisticated toolkit. It produces these toxic enzymes called gingipanes.
Gingipain.
Yeah. They are proteases, meaning they literally chop up proteins. And emerging research suggests these enzymes can damage the endothelial cells of the blood-brain barrier, allowing the bacteria to just cross over.
Into the brain.
Into the brain. And once they're in there, they trigger microglial cells, which are the brain's resident immune cells. This creates neuroinflammation. In fact, P. gingivalis and its gingipanes have been physically found in the brain tissue of patients with cognitive decline.
So treating gum disease is basically fitting protective armor for your heart, your metabolism, and your memory.
That's a great way to put it.
It entirely recontextualizes what the dentist is doing. But let's move away from the bacteria for a second. If the body is constantly under siege from this microscopic city, it must have a defense mechanism. I want to talk about saliva.
Oh, saliva is fascinating.
Because I've always just thought of saliva as the biological response to smelling a pizza. It's just a digestive aid. But in the context of systemic health, it's much more than that, right?
We vastly underestimate saliva. It is a highly complex biological neutralizing agent and a liquid bone builder. Yes, it has amylase to break down carbohydrates, but it's also packed with antibacterial enzymes, immunoglobulins, specifically IgA, which binds to pathogens to neutralize them.
Okay.
And it is super saturated with essential minerals like calcium and phosphate.
So it's constantly washing over the teeth, repairing the microscopic damage the bacteria just did.
Exactly. It's this continuous remineralization cycle. But because of this complex, highly calibrated makeup, saliva is also a profound diagnostic biofluid. The volume and the pH of your saliva tell a deeply systemic story.
Meaning, if a dentist looks in my mouth and sees my saliva is off, they aren't just looking at a dry mouth, they're looking at a system warning light.
Correct. A sudden drop in salivary flow, or a shift to a highly acidic oral pH, isn't just an inconvenience. It severely compromises your ability to buffer acids, which leads to rampant decay.
Right.
But more importantly for the practitioner, those changes are early warning signs for underlying systemic issues. It could point to a developing metabolic disorder, an autoimmune condition like Sjogren's syndrome, or even significant hormonal imbalances.
It really makes the dentist a detective.
They absolutely are.
And speaking of the physical environment of the mouth, we need to talk about the physical teeth themselves. I think the common assumption is that we want to keep our natural teeth so we have a nice smile for photographs, aesthetics.
Sure.
But keeping your natural dentition plays a massive role in how we physically age.
Aesthetics are valid, but functionally, keeping your natural teeth is about maintaining vitality and structural integrity as we get older. On a basic level, it dictates your chewing efficiency.
Right. If you lose teeth and lose the ability to break down complex, fibrous, nutrient-dense foods, your diet naturally shifts towards softer, highly processed foods. And when your nutrition plummets, your overall health rapidly follows.
But it goes deeper than just chewing food, doesn't it? It has to do with the jawbone itself.
Yes. The architecture of your face relies entirely on your teeth. Your jawbone requires constant physical stimulation to maintain its density.
Okay.
Every time you bite down and chew, that mechanical force travels down the root of the tooth and stimulates cells in the bone called osteoblasts, signaling them to keep building and maintaining bone mass. It's called a piezoelectric effect.
So when you lose a tooth, the bone just stops getting that signal.
Precisely. The body is incredibly efficient. If it senses a section of bone isn't being used to support a tooth, it stops sending resources there. The bone literally begins to resorb or melt away.
It melts away. Basically, yeah. Preserving a functional, natural bite maintains that crucial jawbone density, which acts as the foundational scaffolding for the lower third of your face. It supports the muscle tone of your face and neck, preventing that collapsed, prematurely aged appearance.
That is fascinating. Keeping your teeth keeps your jawbone actively alive.
Exactly.
Okay, so if the mouth is a gateway for bacteria and a diagnostic window through our saliva, it's also the literal physical funnel for our oxygen.
Right.
And this brings us to one of the most unexpected frontiers of dentistry: airway health. Usually if I'm snoring or I have sleep apnea, I'm thinking I need an ENT or a sleep specialist. Why is the dentist often the very first responder for airway issues?
Because a dentist is staring directly into the entrance of your airway every single time you open your mouth.
Well, that makes sense.
They are in a prime position to spot the structural and anatomical red flags of breathing issues long before anyone else does. A modern dentist isn't just looking at the enamel, they're evaluating the entire three-dimensional oral architecture.
Walk me through that. What are the specific anatomical clues that tell a dentist, hey, this person can't breathe well at night?
They're looking at the shape and volume of the space. For instance, they look for a narrow dental arch or a high vaulted palate.
Why does a high palate matter for breathing? That's just the roof of the mouth.
Because the roof of your mouth is also the floor of your nasal cavity.
Oh.
Right. If your palate is high and narrow, it physically intrudes into the nasal space above it. It drastically reduces the volume of your nasal cavity, making it incredibly difficult to breathe through your nose.
I never thought about that.
They also look at the back of the throat, the pharyngeal space. Are the tonsils enlarged? Is the uvula elongated? Is the tissue crowded? Because if that space is already tight while you are awake and sitting upright in a chair, it is guaranteed to collapse when you lie down on your back and your muscles relax during sleep.
There's another visual clue in the sources that really caught my attention: a scalloped tongue.
Yeah.
I've seen this in people where the edges of their tongue literally look like a pie crust, with deep indentations. What is the mechanical reason a tongue ends up looking like that?
A scalloped tongue is a massive red flag for a restricted airway. It happens because the tongue is either too large for the mouth or, much more commonly, the dental arches are simply too narrow to house a normal-sized tongue.
Okay.
Because the tongue has nowhere to rest comfortably, it spreads out and presses hard against the lingual side of the teeth, molding to their shape over time.
So the tongue is actively pushing against the teeth to avoid falling backward into the throat.
Exactly. It's an anatomical compromise. Your body is forcing the tongue forward to keep the airway open, and it leaves physical imprints. It also points to a tongue-thrusting habit where the patient subconsciously uses the tongue to stabilize the jaw during sleep.
Which brings us right back to the hook we opened the show with. The idea that your body will physically destroy your teeth to keep you breathing. This is where we have to talk about bruxism, or teeth grinding. I think the universal assumption is that if you wake up with a sore jaw and ground down teeth, you're just stressed out about your boss or your mortgage.
Right, everyone blames stress.
But the mechanics behind night grinding are actually a survival reflex.
Stress can amplify the tension, absolutely. But daytime stress doesn't explain the sheer, brutal mechanical force of nocturnal bruxism. In many cases, grinding your teeth at night is an unconscious rescue maneuver to save a collapsing airway.
Explain the physics of that. How does clenching my jaw open up my throat?
Imagine you are in deep sleep. Your muscles relax, and the soft tissues at the back of your crowded pharyngeal space collapse, sealing off your airway. This is obstructive sleep apnea.
Right.
You literally stop breathing. Within seconds, your blood oxygen levels drop and your carbon dioxide levels spike. Your brain detects this toxic environment and essentially hits the panic button.
The brain wakes up just enough to realize it's suffocating.
Yes. And to force oxygen in, the brain triggers a massive contraction of the jaw muscles, the masseters and the pterygoids. This intense clenching and grinding motion physically thrusts the mandible, the lower jaw forward.
Okay.
And because the base of the tongue is attached to the lower jaw, thrusting the jaw forward drags the tongue away from the back of the throat, temporarily reopening the airway so you can gasp for air.
That is unbelievable. Your central nervous system is willingly sacrificing the enamel of your teeth, grinding them down, just to pry the airway open.
It is a brilliant biological failsafe, but the systemic cost is astronomical. Because if this is happening 20 or 30 times an hour, you are never actually reaching restorative deep sleep.
And what happens to the body when it goes through that cycle of suffocating and panicking all night, every night?
Your sympathetic nervous system, your fight or flight response, is thrown into complete overdrive. Every time your brain panics to open the airway, it dumps cortisol and adrenaline into your bloodstream.
Just constantly stressed.
Yeah, your heart rate spikes and your blood pressure shoots up. This puts immense chronic strain on your cardiovascular system. Over time, this constant hypoxia, lack of oxygen, and relentless stress response accelerates cellular aging and dramatically increases your risk of hypotension, arrhythmias, and heart failure.
So if someone figures out they are grinding their teeth and they just go to the pharmacy and buy a cheap plastic night guard to protect the enamel, they're missing the entire point.
In fact, they might be making it much worse.
Really?
Yeah. A bulky, over-the-counter night guard can actually take up precious room in the mouth and inadvertently push the lower jaw backward, further obstructing the airway. You might protect the teeth from chipping, but you are still suffocating.
Oh, wow. So what is the actual solution then?
The solution is addressing the structural airway issue. This is where an airway-aware dentist becomes absolutely invaluable. They can design custom mandibular advancement devices or dental sleep appliances.
How are those different?
Unlike a generic guard, these are highly specialized devices calibrated to gently hold the lower jaw in a slightly forward position while you sleep.
Which keeps the tongue from falling back.
Exactly. It mechanically stunts the airway open. It protects the teeth from the destructive forces of grinding while simultaneously restoring deep, uninterrupted, oxygen-rich sleep, shutting down that cardiovascular strain.
Okay, we have covered a massive amount of ground here. We're looking at huge systemic risks: inflammaging, arterial plaque, insulin resistance, neuroinflammation, and cardiovascular strain from collapsed airways.
It's a lot.
Knowing all of this, how do we take control of our oral environment on a daily basis? Like, what are the actual mechanics of the daily habits we need to implement?
The foundational pillar of daily protection is biofilm disruption. The microscopic city of bacteria we talked about earlier naturally forms a sticky biofilm on the teeth. You have to physically disrupt that film every 12 to 24 hours to keep the anaerobic bacterial load low, preventing the shift into dysbiosis.
This means brushing twice a day with a soft, bristled brush. But I imagine brushing only gets the smooth surfaces. What about between the teeth?
That is the critical zone. The interproximal spaces between the teeth are oxygen deprived.
Right.
That is exactly where the most dangerous, inflammation-causing anaerobic bacteria thrive. This is why daily interdental cleaning is non-negotiable. Using floss to scrape the sides of the teeth, or better yet, appropriately sized interdental brushes, physically breaks up those hidden colonies.
Got it.
And we cannot forget tongue scraping. The rough surface of the tongue harbors a massive reservoir of bacteria. Cleaning it daily removes a huge portion of the microbial load that drives that systemic inflammation.
So we mechanically disrupt the bacteria at home. What else?
We need to optimize the physical environment for oxygen and saliva. This means training yourself to breathe strictly through your nose, both during the day and by using mouth tape at night if necessary.
What is the biological advantage of nasal breathing over mouth breathing?
When you breathe through your nose, the air passes through your paranasal sinuses, which produce a vital gas called nitric oxide. Nitric oxide is a potent vasodilator. It expands your blood vessels, lowering blood pressure and improving oxygen uptake in the lungs by up to 20%.
Wow.
Furthermore, keeping your mouth closed maintains the moisture and optimal pH of your oral cavity, allowing that salivary buffer to protect your teeth and gums. Mouth breathing dries out the saliva, creating an acidic, bacteria-friendly environment.
Okay, so we're disrupting the biofilm and breathing through our noses. But clearly, we need a professional to look at the structural architecture, measure the hidden inflammation, and catch these airway clues early.
Absolutely.
Which brings up the massive elephant in the room, the dental anxiety dilemma. People avoid the dentist. They associate it with pain, judgment, or just a profound sense of loss of control.
And that anxiety is precisely the barrier that allows these systemic issues to compound. People postpone care out of fear. That delay allows a simple, totally reversible gingivitis to transform into chronic, bone-destroying periodontal disease. It allows airway issues to quietly damage their cardiovascular system over decades.
This is exactly why the philosophy at my gentle dentist Arana Hills is so vital. Their entire operational model is designed to solve this specific dilemma. By prioritizing comfortable, anxiety-free, low-stress care, they completely remove the psychological barrier to entry.
Which is huge.
It is. They approach dental care not as a luxury customer service perk, but as an absolute medical necessity.
Because if the experience is compassionate and modern, patients comply. They don't postpone care. They actually come in for their comprehensive soft tissue examinations. They get the preventative cleanings.
Right.
They allow the practitioner to catch the inflammation and structural issues early, protecting their whole body wellness. It essentially transforms dentistry from a reactive, fear-based repair job into proactive systemic health optimization.
Which is exactly the standard of care everyone should be seeking out. It's really time to stop treating the mouth like it's disconnected from the rest of the body. If you want to take control of your systemic wellness, if you want to address hidden inflammation before it accelerates aging, or if you finally want to figure out why you aren't sleeping well, you need a clinical team that understands this deep biology and prioritizes modern gentle care.
Absolutely.
You can visit my gentle dentist, aranahills.com/RA.R, to learn more about this approach or to schedule a visit.
Understanding these pathways completely changes how you view your own biology. It really empowers you to take action.
It really does. Which leaves you with this final thought. Tomorrow morning, if you wake up with a sore, tense jaw or a dull headache, don't just assume you are stressed out. Ask yourself, was your body secretly fighting a brutal battle to breathe all night long?